Alex was a happy child. As he got older, he still had a loving family and a stable life. Then, he started to feel more down than usual, more down than the people around him. He had lost interest in all the activities he used to enjoy. He lost sleep and an appetite. Eventually, it was hard to focus and get out of bed. He thought that no one cared about him. His parents didn't know what to do, but a friend had noticed him becoming more withdrawn and suggested that he see a doctor about it. Alex had had his doubts. He thought that they couldn't be fixed and that his case was completely hopeless. It crossed his mind that maybe death was the only solution. At this stage, Alex truly realized that he needed help and had to see a therapist. Their primary physician referred them to Dr. Smith, a clinical psychologist. Today is their intake appointment with him.
Hi. Hey, good morning, Alex.
Good morning, Dr. Smith. How are you?
I'm okay, how are you?
I'm alright.
Have a seat. And I'm just going to start off by asking a few basic questions. Have you seen a therapist before?
No.
Well, then I'm going to preface the rest of my questions by saying that whatever you say in this room is confidential. I take your privacy very seriously. The only time I will ever tell anyone about what goes on in these sections is if you have a plan to attempt suicide or you have a plan to hurt another.
Okay. Have you talked to my parents?
Yes, I did. I wanted to hear about you from their perspective and to just have them in the loop about your therapy.
Talking about the patient's past experiences is very important to create trust between a patient and his therapist. It also betters the understanding of the therapist about treatments that may work for the patient.
Well, it looks like we're getting a little bit closer to a diagnosis. Here, fill this out.
Okay.
The PHQ Patient Depression Questionnaire is one of the most common depression questionnaires used for diagnosing depression. There is a series of 10 questions, 9 about the symptoms, and the 10th about how the symptoms affect the patient's life. While one can take it outside of therapy, going to a psychologist is the best way to get an accurate diagnosis.
Well, it looks like you have severe depression. My approach to therapy is a cognitive one.
What does that mean?
Cognitive therapy targets how you think. I personally incorporate more of cognitive behavioral therapy into my approach.
What's the difference?
Cognitive behavioral therapy not only focuses on your thoughts, but on your behaviors. There are specific models for different disorders, so your depression will be focused on.
That sounds good.
One of the first steps is to inform you about your disorder and discuss treatment goals. Is this okay to start in the next appointment?
Yeah, sure.
Since you are still a teenager, the therapy would work best if your parents were involved.
No!
Getting your parents involved would help them understand your disorder better, help them support you in your therapy, and help them learn new parenting skills.
It sounds reasonable, but I'd rather not.
This would still be your treatment, and we will still be having one-on-one sessions. Would you like to have therapy with them in a group setting?
Possibly.
There's a group at the clinic that meets every Thursday evening. You won't be the only one in your age group there. It's comprised of teenagers with one of their parents. Do you have a preferred parent that I can send information to?
My dad's more available on Thursday nights than my mom is.
There are also biomedical options for your treatment.
Does that mean that I'd be taking pills?
Well, that is the most common method of biomedical therapy. However, there is also electroconvulsive therapy and psychosurgery.
Is electroconvulsive therapy still used today?
Yes, but only in severe cases. It is much safer than it used to be, and it does not cause memory loss anymore. It has just become stigmatized. You probably won't have to worry about it since your case doesn't warrant.
What will the drugs be like?
Well, there are a wide variety of drugs you can try. There are SSRIs, SNRIs, tricyclics, and MAOIs. They do not instantly make you happy, but over time they will help you manage your symptoms better.
I've had friends tell me that they make you feel nothing.
Well, that's just not true if you find the right medication. It will take a lot of trial and error for you to find the right medication, but that's just not the case.
Okay. Can you prescribe me some drugs?
I'm afraid not. I'm only a psychologist. A psychiatrist can prescribe you medication. I can give you a referral to one if you want.
Okay, yes, please.
Here is Dr. Jones's card.
Alright, thank you.
He has had a lot of success with cases similar to yours, so I hope that will help.
Alright, thank you. I'll give him a call.
Alex continued to get treatment that included both biomedical and cognitive therapies. He started himself on the road to recovery, and after several months, he made progress. Alex went on to complete the group therapy with his dad. Not only did this strengthen their relationship, but also made their dad more supportive of his depression. All of these changes made Alex more hopeful for a bright future, a future where they fully enjoyed life and succeeded. They were on their way back to stability. Alex was a happy child. As he got older, he still had a loving family and a stable life. Then, he started to feel more down than usual, more down than the people around him. He had lost interest in all of the activities he used to enjoy. He lost sleep and an appetite. Eventually, it was hard to focus and get out of bed. He thought that no one cared about him. His parents didn't know what to do, but a friend had noticed him become more withdrawn and suggested that he see a doctor about it.